Hello and welcome as everyone is joining. We'll give it just a minute for everybody to get into the webinar and get their sound connected. Great, wonderful. So welcome to everyone who is joining today. We are very excited. Our team is so excited to be hosting this sixth and final webinar in the Foundational Technical Assistance Series, hosted by the National Early Care and Education Workforce Center. Today's webinar is being recorded, and we will share it out via email for everybody who registered, as well as posting it on our website. If you have questions today, please feel free to put them in the Q&A that you'll find at the bottom of your screen. We will do our best to answer those questions during today's webinar, and for any questions that we're not able to answer today, we will be sure to follow up with those responses. Before we get started, we'd like to share the following message with today's attendees. If we can skip to the next slide. The work of the center is funded by the Administration for Children and Families, and so we're very grateful for that partnership with ACF to be able to bring this information to you. However, the views and perspectives shared during today's webinar do not necessarily represent the views or an endorsement by ACF. So we'll continue on and introduce today's facilitators. For those of you who've been joining along in this series over the last 6 months, already know Dr. Sherry Killen-Stewart and Dr. Aisha Ray, who have been the facilitators for the entire session. I know that we've all appreciated learning from Drs. Killen-Stewart and Ray over the course of this series, and I want to express my gratitude to them for their facilitation and sharing their expertise throughout this series. And in today's session, we are also welcoming Sheetal Singh with Start Early, who will be sharing some information about using human-centered design in our workforce efforts, as well as Bibi Otero, who will be sharing about the work happening on behalf of the workforce in Washington, D.C. So welcome to those presenters, and we're excited to learn from them. And we'll start with a poll. We'd like to learn from you if you've attended these sessions before or watched any of the recordings. Have you been able to share any of the information with others and or not? And so curious to hear from you about your participation. If we can open the poll, and please go ahead and respond to this poll, letting us know about your previous experience with the webinars in this series. Results are coming in, and we'll share those in just a few seconds to give everyone a chance to select the response that applies to you. Wonderful, thank you. Great, it looks like majority of people who are here or close to the majority have been able to share it, and some are planning to do so. And so if you haven't, then feel free to do that. Again, all of the recordings from each of the webinars in this series are available on the website for the National ECE Workforce Center. And so those will be available to you ongoing for your own work, as well as sharing with others. So with that, I'm going to turn it over to our facilitators to move us into the final session today. Thank you.
Thank you, Sandra. Good day to all of you. I am Aisha Ray, and I'm very pleased to be with you here on our last webinars for the foundational series. Today, we're going to focus on financial resources rather, and sustainability. And as you will see, next slide, please. As you will see, our goals for this webinar are to apply the processes, the strategies, and tools we've discussed in webinars 1 through 5 and to apply them to our thinking about financial resources policies that intentionally and effectively remove inequities related to race, ethnicity, and other factors associated with discrimination, to also focus on sustainability of the policies, practices, and system changes leaders make to advance financial resources policies intended to benefit the early care and education workforce across all sectors. And we're going to also have the pleasure of hearing from two of our colleagues, Shatal Singh from Start Early and Bibi Otero, who will talk about from the Otero Strategy Group, that will talk about the DC, the work that has been done in the District of Columbia around these issues. Next slide. We are always interested in looking at how what we have talked about in the previous 5 sessions have benefited you. This is just a taste of that information we've gathered from you. And this is particularly in response to webinar 5. We heard again that people are really focusing on gaining new knowledge and new ideas of how to do this work. They're also focusing very much on working with others, including engaging state legislators and policymakers in addressing issues of early childhood workforce compensation, also learning more about how they can influence and address cross-systems change, also beginning to build new tables or to make old tables more inclusive, focusing on sharing information with colleagues and bringing it back to those they work with, and intentionally connecting with the workforce, as we have discussed this many times, an incredibly important part of this work to change the policies that have shaped and really disadvantaged our early childhood workforce and to create new policies that benefit them. And finally, a number of people talked about connecting across systems, attending, one person said, attending meetings of those we need at our tables and not just invite them to meet with us. It is taking action to really include people and strategically thinking about how our work can align with the data shared today in recruiting, maintaining, and sustaining a livable wage for ECE professionals. This person also stressed this issue of connecting across systems in her comments or his comments. Next slide, please. We also want you to think about what we mean, for those of you who may be thinking financial resources may really mean, if you haven't been with us before, that we're talking about things like health insurance and those kinds of issues. In this webinar, we're really talking about those policies that indicate deep public investment in the early care and education workforce and the broader early childhood system through a variety of actions, including legislation, comprehensive sustainable financing, effective public relations efforts that elevate successes and build public support, among other things. And the policy strategies, examples that we want to think about, but we invite you to think about more, are Head Start and Early Head Start, American Rescue Plan, preschool development block grants, and use of federal funds to sustain mixed delivery systems, again, among other kinds of policies. Next slide. When we think about sustainable public investments in the early childhood workforce that will contribute to an ECE system, what is it we want that system to have as its characteristics? We want it to be universal and of high quality, to be equitable, inclusive, and culturally responsive. We want it to be available to every child birth to 5 and their families, regardless of circumstances or geography. We want it to be adequately funded through funding streams that are stable and sustainable over time, that ensures the workforce is adequately compensated so that they and their families are financially stable and secure, that supports workforce professional development and advancement, addresses historic and current inequities intentionally and effectively so that they are not replicated within early childhood systems, want to work across systems, across child welfare, housing, nutrition, and other systems that may affect young children and their families who are in early childhood care and education programs and services. And we want to engage in continuous quality improvement. There probably are other things you hope that we will do, and we want you to add them into the chat if you think of them. But these are the key ones that we have thought about that are essential for the work that we wanted the National Center to support. Next slide, please. So let's take a poll. We use these polls to be more interactive, and so let me ask you this one. In your regards your current status of your work on financial resources and sustainability, currently, where is your state, tribe, county, community, or program in advancing policies and practices or services that intentionally address financial resources and sustainability? Are you just beginning to do this? Have you been doing it for at least 12 months? Have you been consistently doing this over 12 months, or none of the above? So take a moment to add your thoughts to this poll. Daisy, let me know when you're ready. Okay, so 28% are just beginning to intentionally address this. 29% have been doing it consistently for at least 12 months. 34% have been doing it over 12 months, and only 10% none of the above. So that's a pretty good example, pretty strong representation of focus on this work amongst all of you. Thank you. Next slide. So thinking about that last question, share some of your understanding. For those of you who answered the last question with 1, 2, or 3 regarding your current work to intentionally and consistently address financial resources and sustainabilities, who or what entities are in the decision-making process with you? You can check, for example, the top 4 partners that you have. Ready, Daisy? So 56% of you have workforce members representing sectors such as childcare, family, friend, and neighbor, pre-K, infant, toddler care. Great. 19% fiscal policy consultants, 10% sustainability consultants or advisors, 48% federal, state, tribal, county, and other entities, and 32% institutions of higher ed. Very good. Now we're going to ask you the same question, but ask you who's not at the table. So that's the next poll. Who is not at this table, but should at your tables, thinking about financial resources and sustainability? Who's not there, but should be part of your decision-making process? So the results are those who are not at the table: workforce members from the various sectors, fiscal policy consultants are not, sustainability consultants for 33% are not. I'm sorry, for fiscal policy consultants, 28% are not. Federal, state, tribal, county, and other entities, 22% are not. And institutions of higher ed, 21% of you said that they are not at the tables. Very interesting, and also interesting that other groups that are on our list here haven't been mentioned, but that we asked the question in a way that asked you to identify four. But parent groups, private foundations, advocates, and others were not mentioned in either responses. So that's something for us to think about. How big is the net that we are casting to try to include others? Next slide. And that's the poll results slide, so we can skip that, Daisy, and go on to this. And you can move from this one as well. We are now going to talk about systems, cross-system work, how to build networks. Again, something we've stressed repeatedly in this, and thinking about within your role, how do you do this work? So what work is currently going on in your state, tribe, county, territory, or agency in terms of these elements? Financial resources, strategic planning for financial resources and sustainability, building cross-system teams, engaging fiscal planning and sustainability consultants to work with you. Many of you indicated you were doing that already. Talking with legislators regarding funding, legislation, and others. So we are not asking you to respond to this with a poll, but we want you to really think about where are you on these particular elements that we think are critical. And now, then the next poll, I'd like you to share your understanding of your own authority and influence. And we've asked you to think this way a number of times. Within your current role, authority and influence, how responsible are you for policies and practices that affect financial resources and sustainability? Are you very responsible, minimally responsible, or not responsible at all? Great, thank you. So 15% said you were very responsible, 24% responsible. So that's almost 40% of you who have a fair amount of responsibility for this work, in this area of work. 40% minimally responsible and 21% not responsible at all. The point we're trying to make here is that each of these levels of responsibility, it is possible to begin to think about how you can engage around these areas of policy work, and would like to encourage you to do that as you move forward. Next slide, please. We also, that's poll, keep going, Daisy. Would also like you to think about who you need to advance your work. For financial resources and sustainability, we've added a whole list here of entities, the workforce, fiscal policy consultants, sustainability consultants, and so forth, including childcare licensing, advocates, legislators, unions, and entities that represent workers, and media consultants or advisors. Who else? Who are we missing? Who should we be thinking about? Who are you thinking about to help you around the work around financial resources and sustainability? Next slide. So here we want you to think about what we think has emerged in these conversations we've had with you over these many months. That's a critical question. How will you measure success regarding each of these policy elements that we've talked about over the last number of months? But for today, we'd like you to share with us how you will measure success regarding financial resources and sustainability projects in 2 years and in 10 years. So if you use the Mentimeter, there's a place to respond in terms of 2 years. What are your measures of success in 2 years around these two dynamic issues, financial resources and sustainability policies? And then in 10 years, what are you expecting you will see and how will you measure it? So if you take a moment for that, that would be great. So the results for this, which I cannot see, Daisy, for some reason I lost my, thank you. So how we, great, okay. So 11 responses. How will you met 12, 13? Great. Still coming in? 14, 16. Great. Can you sorting it? Okay. Daisy, you have a final response? Great. So we have 29 responses. And as you can see, there's a lot of variation here, but a lot of commonality. Retention is a key issue for many at 2 years. Robust compensation package, sustainability of quality early care programs such as Head Start and Early Head Start, pay increases for early childhood workers, work harder, been an advocate for childcare providers. I'm not, okay. Again, retention, program sustainability, quality in staff, attracting new grads. These are all important measures for us in terms of what we know is problematic currently within our workforce and what we hope to achieve over this time. So for new responses, okay. Staff retention, more staff retention. This is the 10-year result, Daisy. Are you right?
This is a summary of all the responses.
Oh, summary of all, okay, of 2 and 10 or just of both of them or one of them?
Yes, 2 and 10.
Okay, good. 12 responses on retention, program accessibility, 2 responses, financial compensation, 1, and infrastructure support, 1, workforce diversity, 1 response, more people of color, staff retention, robust compensation. These are right in the ballpark. So really appreciate your thoughts about this. And I know because you're working so hard on this, these issues are in your mind all of the time. Thank you. It was great. It is now my privilege to introduce to you one of my dear colleagues and friends who has a lot of experience trying to make all of this work, just as you are. So I'd like to welcome to our webinar, Bibi Otero, who will talk about the District of Columbia work that she has taken part in over years. Bibi?
Thank you, Aisha, very much, and welcome everybody. I'm very excited to share this information because we have worked for 10 years at least trying to get to where we are in the District of Columbia. So I hope that this is helpful, and it's very much in line with a lot of what Aisha has just reviewed with you. I will focus, we passed a piece of legislation called the Birth to 3 legislation in 2008. You can go to the next slide. And in that, the legislation in 2018 that we passed was called Birth to 3, focusing on infants and toddlers in particular, and the infant and toddler workforce in particular. And one of the aspects of this piece of legislation, it is a very broad systems piece that deals with a lot of the issues that were talked about earlier in terms of a system. But we'll focus today on one aspect of that policy, which is compensation equivalent to the average base salary and fringe benefits of an elementary school teacher employed by the public school system in the District of Columbia with equivalent role credentials and experience. We wanted to make sure that when we got to a point where we were actually being able to address equitable compensation and sustainability around wages, et cetera, is that we tied it to some existing scale and system. And so this was tying it to the public school system, which negotiates with its union, obviously, the scale for teachers. The reason the birth to 3 is because it follows the 2008 pre-K for all, which we passed back 10 years earlier than that to get universal pre-K. And that piece of legislation required that the pre-K teachers and assistant teachers in community-based settings receive the same salaries as the pre-K teachers and assistant teachers in the public school system, and that they have the same credentials. So this is why this was split up between birth to 3 and 3 and 4-year-olds. Next. So as all of you know, and you noted with all of the people that you have participating in the work that you're doing, is that none of this works without a really robust advocacy. First of all, the birth to 3 law came up after 2 decades of advocacy work to build an equitable early childhood system in the District of Columbia. The coalition initially set up to support the passage of this legislation includes a host of folks. I'll talk about this in a little bit, and philanthropy, which is really a key piece here because philanthropic dollars have much more flexibility than public dollars. And so we were able to tap those, especially on the advocacy side and getting the legislation. Our advocacy is made up of 40 organizations, parents, grandparents, providers, and also really important folks who don't necessarily have children in early care and education, but who are interested in the well-being of children in the city. And then the compensation provisions remained unfunded for 3 years. Okay, so we passed the legislation in 2018. It took us 3 years to get the funding for that legislation, or for at least the compensation part of the legislation, to actually go into effect. So if there's any lesson here, it takes a long time. It takes a lot of organizing. I am an organizer at heart, so I believe in organizing and having really strong advocacy that moves the agenda forward. Next. If we do it all in the public sector, then we won't get there. The other thing that was really important is to link the regulation. So if we were going to tie a salary scale to the salary scale of the public school system, we needed to also begin to move our licensing requirements so that in fact early care educators could benefit from a salary scale that mirrored the public school system. So we changed the regulations so that folks, as you can see here, directors by 2022 had to have bachelor's degrees, lead teachers had to have AAs, etc. And this way we could link up to a salary scale at the school system. Next. So next, we secured our funding by through this coalition and spending a lot of time thinking about what was the best. You know, Aisha talked about sustainable financing, stable financing, and we know from everything we've heard around the country that some of these regressive taxes, et cetera, don't give you the long-term stable, sustainable funding. And so we were able to work with other coalitions to develop a joint strategy. We talked about the things that affect our families, and housing being one of them, EITC being another. And so we worked with a coalition and came up with a joint effort of early educator compensation, housing supports, and EITC. We focused on tax justice, so correcting inequities in the tax structure. High-income individuals were were paying less taxes than middle income. Our approach was to modestly raise the personal income tax on those highest earners, so a wealth tax, basically. And the tactics were the ones we all know: testimonies at hearings, town halls, citywide events, embarrassing people, highlighting, being proud of those who supported this, but really making policymakers sign as they were running for office, making them sign assertions that they would in fact support this kind of funding. And this resulted in a total of I think about something like $150 million in tax funds, and 75 of that then went to an early educator compensation. So this is a recurring tax. It's a wealth tax, and it provided a significant amount of money for a compensation strategy. Next. So the original legislative mandated that salary increases would be done through the subsidy program, and we found out really quickly that had a lot of inequities to it, and that in fact, regardless of whether a provider was serving subsidy children or not, providers, early educators across the board are underpaid. It didn't matter whether they were serving low-income children or not. So we made a decision in the city that this compensation benefit would go across the board regardless of subsidy or not, with a supplemental or an additional funding for those who were providing care to children in subsidy. The implementing agency, the council, and the community had a lot of issues around that approach, and this is why we made the switch. Once the revenue was secured, funds deposited in, this was really key, in a non-lapsing fund. We were very concerned that once we have the funding, we put it in a non-lapsing fund, because it would take a couple of years to get the system in place to actually provide the additional compensation to early educators. We did create, with the help of the council, an early educator equitable compensation task force. It was appointed by the council, and their role was to make the recommendations of how the dollars would be distributed. Next. While we waited for the agency, which was our state Department of Education, to be able to put into place the system, we did not want to have dollars sitting in a fund. And so we suggested that there be a short-term mechanism, which was supplemental payments that went directly to educators. And we used an external organization that had been doing some of this for the pandemic and had developed the skill set. And they then, as you can see here, provided fixed stipends for educators at 10,000 level, and for assistant teachers, and 14,000 for lead teachers. And this was for about a year and a half, basically fiscal year 2020, 22-23, that gave the State Office of Education time to establish a mechanism and a system, a new salary scale, and then tied that to the school system. And so as of September last year, I'm sorry, where are we today? We are in May. So as of December, the structure went into place, and it basically meant that providers directly received the dollars, so that this was no longer a supplemental, but it was actually a change in salary. And this is really critical for a number of reasons. We always hear about supplementals and bonuses and that sort of thing, but that doesn't change the base salary of folks. And what we want to do is have an influence long-term. A lot of our providers are women of color, in many cases older women. And so we thought about Social Security and what it means to have your salary increase, so that in fact your Social Security would be higher. What does it mean to have your salary increases? Obviously, to stabilize funding for families who've been living on a very really much in low income and substandard salaries. The other thing we have to think about is what are the consequences of increasing your salary, and those for many of our providers or our educators, it meant losing public benefits. So one of the things we included in this was paying for health insurance. So we worked with our healthcare exchange, and all of our teachers and their families receive health insurance through the same funding. Next. And so you can see here what the salary basis was for assistant teachers and for lead teachers, and with a CDA, with an AA, and with a BA. So it's a huge shift in, all of a sudden seeing teachers making $66,000 a year in a childcare setting. That was unheard of. Next. So some of the considerations that we have to take in place: cash flow, the need to make sure that we're advancing the funds, because our providers do not have the mechanism by which they can upfront the dollars for increasing salaries. So we needed to make sure that the mechanism was providing the funds ahead of when you have to make the payments to teachers' salaries. So we wanted to limit administrative burden. There had to be a lot of technical assistance to providers in order to make sure that they, we found a lot of providers who's, needed help in getting their finances straight, et cetera, to be able to provide the data they needed to provide in order to get the funding for salaries. So there's a base salary set in place. So let's say $32,000 a year for an assistant teacher. And then the dollars that come from this fund make up the difference between that and what's the salary scale. So those, these are some of the considerations and some of the things. And obviously the equity concerns. We have undocumented educators. We have issues of language access. We have individuals who with limited literacy and certainly limited tech literacy. So we had to address all of these issues to make sure that we had an equitable system. Next. Challenges. The challenges: data. If you don't have a registry or a centralized way of understanding where your workforce is, catching up to that has been really, really difficult. And we didn't have a good, we still don't necessarily. And so we're populating a system right now and having providers and individual educators populate a system so that we're able to make sure that everybody's getting the right benefits, the right compensation. I talked about the benefits cliff and making sure that at the very least, in terms of health insurance, we were supporting that. Tension and trust between employers and employees. Lots of work around working with teachers who may not be trusting that their employer will in fact pass the dollars onto their salary. And so working through all of those and educating folks. Burdens of reporting, barriers to education, for example, for people to move their up the ladder in terms of their credentials. There's lots of issues around verification of credentials, foreign credentials, and hoping that we can really work with foreign credentials and make sure that they're validated in a way that folks can access the compensation. And then, threats to funding. Next. Basically the threats to funding are a huge piece. We are right now in that process. We're not any different than many states that are right now seeing their 25 budgets be really, really tight. And so we are running risks of some of the funds in the pay equity fund getting pulled by the mayor, who wasn't a real champion of this. We really, our champions were more in the council. And so I think one of the most critical pieces here is to maintain the advocacy, the organizing, once the legislation passes, then around implementation, and then around sustainability. And so you can't let up. It's not a one and done, but it really is important to make sure that we are constantly keeping an eye on the funds and making sure that they are not grabbed for some other priority in the city. So I'll stop there. And if there are questions, I'm happy to deal with those later. Thank you.
Thank you so much, BB, for that on the ground information. In this next section, I kind of want to pull it all together and offer you a couple of frameworks. On the next slide, it talks about from the 2015 report on transforming the workforce. Next slide. And it offers that, as BB was talking, she was talking about state change or DC change, what the local processes are, and Aisha opened it up, putting it in the national context. And so we have to be managing all three of those at the same time. The work that we've been presenting to you over the number of weeks dealt with requirements and qualifications, professional learning and ongoing practice. That includes the time at higher ed and professional development, and evaluation and performance. And all this is undergirded by strong features of child development and early learning and principles to quality professional practice. And so each state needs to think about how they are creating an infrastructure for that system. As we've done this workshop, we've talked to you specifically about the sections from the Center for the Study of Childcare and Employment. We've offered you session, next slide, on compensation and financial relief, qualifications and educational supports, income supports, workforce data, knowing who your workforce is and where they are and what their levels of education are, financial resources, one example BB just gave you, and then work environments. And all of this is in the context of having income supports and supporting health and well-being. As we've outlined the series, we've gone through each of those buckets to try to offer that you can't just work in one of those, you've got to be working across all of those. It's not any one person's job, but the idea is that you're creating a system, that each of these is a part of the levers for the change that we really want to see. And then recently, the Bipartisan Policy Center put out an article, top down, bottom up, building a state child care center workforce. And it offers that you have to define who is the workforce. And we haven't talked as much about that, but each state has to decide. And it was one of the questions that came in the chat. What about people who work with families prior to the babies being born? Are they a part of the workforce? Child care, Head Start. We suggest that all of that is a part of the workforce, but each state needs to be able to define the workforce, determine the competencies, be able to collect and analyze that data, and then support them to move towards quality, being clear about education requirements, what's the pathway and the link between the different levels, and then how will you enforce the competency requirements. And all of that does need to be tied to compensation and cost modeling to ensure that as individuals get more skills, knowledge, and ability, or that they have it, that as BB was talking, we're increasing their compensation to match the education and commitment that they offer to the field. And so there has to be funding mechanisms, not only for the training and the development, but funding mechanisms for compensation. So when you put it together, we in the last, series have tried to talk to you about moving from one-off projects to really thinking about what you want for the entire workforce and who's the leadership that's necessary to support those efforts in higher ed, in professional development, in centers, in programs, so that you link more than one element, as the three charts I just showed you. You link more than one element together so that you got a purpose-driven system aligned with the well-being of individuals and the early care and education programs. Another way to think about sustainable change is that when links are broken, people will fall back. And I love this article that talks about vision and incentives and skills, resource, and plans. And it shows you that if you got vision, but you don't have, if you don't have vision, then people get confused about what it is you're trying to do. If you don't have incentives, then there may be some resistance because why would I be engaged or involved in it? If people don't have skills, they get worried that they're going to be replaced or taken away, it create a sense of anxiety. If you don't have resources, people are frustrated because you're asking them to do something without the set of resources that are necessary for them to be successful. And if you don't have a plan, and this is why I talked about the multiple frameworks that are really dealing with each of those areas, then people feel like they're on a treadmill because those things don't feel connected together. So it's important in your work to build a qualified, well-compensated workforce that you have vision, incentives, skills, resources, and a plan that leads to sustainable change. And that's no one organization's responsibility. It's multiple organizations' responsibility. So I'm going to go to a poll and ask you what's working for you. And then question 2 is where are there breaks in the financial resources and sustainability efforts? So what part do you feel your community, your state, your region is got well? And then where are there breaks in that vision? And make sure you scroll down so you can see both questions in your poll.
We have lots of responses coming in, and we'll share the results momentarily as everyone has a chance to answer both of those, respond to both of those questions.
Okay, so it looks like, 61% feel like there is a vision, but only 31% feels there's real incentives or clarification around the skills and the resources and the plan. When you're saying what's working for you, there's vision, 61%. Less though on incentives and skills, more like a third, and then 25% on resources and a plan. And when I asked you where are the breaks, 21% are saying vision is a break, 46% are saying incentives are a challenge, and 67% are saying resources are a challenge, feeling like the skills are there and there is potentially a plan. And so this gives you an idea of where to work and where to begin partnering as you think about putting together the last series of workshops we've done and where you might need to lean in to move forward. And so with that, we have another presentation from our collaborating partner, Start Early, to talk to you about the work that they're doing on the ground.
Thank you so much, Sherry and Bibi, for that amazing presentation of your work in DC. I am going to start. My name is Sheetal Singh. I'm with Start Early. I run the in-house innovation lab at Start Early called the Early Learning Lab. And I'm here to present on another framework for thinking about how we do this work together. And you can forward to the next slide, please. So I am going to talk about human-centered design, which I am assuming that most people have heard of, and if not, we'll give an overview so you can understand what it is. An important thing to keep in mind as we're walking through these slides and thinking about how to apply human-centered design to policy and systems change work, I think if you walk away with one thing from this presentation, it's the idea that good design is essential for the sustainability and the success of both policy and systems change work. And I like to think about 3 I's. The 3 I's of human-centered design are, as you're doing this work, you should be intentional, be inclusive, obviously, of the perspectives of everyone who's involved in the system, and most particularly those most impacted by the policies that you're trying to pursue. And then finally, be iterative. This is the part of human-centered design that I think we don't think about too much. We do think about elevating family and provider voice, which is wonderful, but the iterative aspect of human-centered design is contra to this traditional approach that you see here on this slide. We are not talking about planning and then building and then putting something out in the world and washing our hands of it. In a human-centered design approach to systems change, we are requiring really a CQI, or continuous quality improvement, approach to the work, which means that we put something out, we monitor it closely to test the impact of what we're putting out into the world, modify it constantly, and that's the iteration, and then adapt to changing conditions, because any system, as we know, is a dynamic entity. Nothing stays static, and if we're going to be successful in our work as policymakers or as systems leaders, we need to constantly have our ear to the ground to figure out how we can change what we're doing to match new challenges that arise, both with the workforce, with families, and with all of our constituents. So the traditional approach here is one that's been used for centuries, I would say, across many different types of workplaces. It's the idea of really smart people with the best intentions going off into a room, coming up with an idea of how they can make something better, creating it, and then putting it out. And the problem with this approach is that it's a big gamble, really. It's often resource intensive, meaning you're doing all the work behind closed doors. Hopefully it'll go well. We don't always know what's going to happen. And we lack the ability to test things in small iterative ways along the way before we have a big release. And then if we need to change something, potentially we put something out, we go through an evaluation to see what the impact is. The evaluation itself could take many months or many years. And then we go back and we decide that we need to change some aspect of it, and we go through the cycle again. And it's very time intensive. And so human-centered design is a different approach to doing that same type of work. Next slide, please. So human-centered design, as I said, is just a framework and a set of very strategic set of tools, as well as different mindsets, which can be used to solve problems by reframing it to be really about centering the people who are closest to the problem. This has traditionally been used in the development of products and tools, but as you will see, and as you might know, people have started applying these same principles to the social sector in systems change efforts, as well as different policy-based efforts. Next slide, please. Next slide, please. So there are many different diagrams or visuals of the human-centered design process. This one comes from the Stanford Design School. But at its heart, and you might see, I'm sure most of you have seen some version of this slide before, the words might change, but really what the approach entails is a cyclical approach that really involves not just coming up with an idea. You might come up with a problem that you want to solve, but then before you actually decide what to do or what to build or how to solve it, we encourage designers to go out and take the first step of what we call empathizing, or you might call user research, which is really about just going out into the field and talking to people. It sounds very simple. It's actually not so simple, but in many different approaches, there are very specific tools that you can learn to help with this process. But it really means talking to the people who are closest to the center of the problem. So if you are embarking on a systems change effort, and the way that you're going to measure success, as we said in our poll, is through staff retention in 2 to 10 years, right? It makes a lot of sense to begin your process by really centering the experience of the providers themselves. And so you're getting an understanding, you're empathizing with how they see the situation, what considerations they are taking when it comes to choosing where they're going to work or what field they're going to work in. After you go through the process of talking or observing or interacting with the people who are closest to the problem you're trying to solve, you come back and through facilitated processes, download basically all of the data that you've gotten through your research efforts and start to ideate, which really just means brainstorming or thinking about your problem in a different way. Oftentimes when you're in this space, it's very generative. You might actually decide that the problem you were trying to solve is not the problem you should be solving. And that is very, very typical of a human-centered design approach. As you learn more about these different perspectives, you change your own perspective. And we'll see as we talk about kind of keys to success in using human-centered design that having an open mind is probably the most important key to success in using human-centered design, because if you come into this approach thinking that you have all of the answers and then just go through the steps in a check the box way, you're really just wasting everyone's time. If your mind is open and you're willing to listen to people and potentially come to see that you might have been looking at something in a different way, then you will hopefully be very successful. And then we have this step that we call prototyping, which really means thinking about the core of your idea and finding out how to test it in a small way, which means putting something out there, you test your assumption, you validate it by looking at your data before you develop, say, the policy that you want to try to implement or some sort of systems change effort that is going to take a lot of effort to put out into the world. And then when you do finally settle on what you want to do, you put it out in a way that, again, is iterative. So you're testing it and thinking about how you can continually change your design over time to meet the changing needs of the people in your system. Next slide, please. And so this slide is kind of repetitive, but it just shows you, and I won't walk through everything on this slide, but at each one of these stages, it can sound very fluffy, but there are very concrete activities and deliverables that many people, whether they're consultants you could hire or some of the large organizations that have free resources out on the internet, if anyone is interested, organizations like IDEO, for example, or the D School or Luma, you can download PDFs full of activities and toolkits that can help you walk through these steps. Next slide, please. So as we mentioned, this has traditionally been used for product design. Some very famous products that you probably use all the time came out of a human-centered design process, such as the computer mouse, which not too many people use anymore. Actually, we're all, trackpad focused now, but other things like the Swiffer. Really, the idea was in industrial product design. It was kind of revolutionary to kind of stop and think about how people were actually using products and then designing to meet the needs of users. And you can see how the core tenets of human-centered design can and should be applied to solving complex problems related to human services delivery. And the social sector has started to adopt best practices from human-centered designs to co-design systems and programs as well. At the Early Learning Lab, we specialize in taking human-centered design principles and applying it very specifically to challenges within the early childhood field specifically. And you'll see as you start to delve into the literature, it's still, we're still in our toddler phase, I would say, but we're starting to see more and more academic research into the benefits and impacts of human-centered design. Next slide, please. So it's not always easy to do. If it was, then everyone would be doing it. So what are some of the challenges that programs and systems leaders face when they try to adopt a human-centered design methodology? Probably the first one is leadership buy-in. In my consultative work with systems leaders and with programs, sometimes you come to a place where what you hear from the constituents, from the people who are closest to the problem, might not align with an organization's strategic plan. When that happens, I've seen the whole thing just get thrown out the window, which is unfortunate. So you really want to make sure that if you're embarking on a project like this, you have the buy-in of leadership, which means the buy-in of potentially changing your strategy based on what you're hearing from people in the field. It helps if leaders are part of the process, so they're not blocking the work because they haven't been brought along. And if you are going to stick to a strategic plan, which is a wonderful thing to do, you might want to conduct your human-centered design before you develop your strategic plan and not afterwards. Another challenge that we often see is, as you might imagine, this is resource-intensive work, both in terms of time, because oftentimes, actually all the time, this approach involves a slowing down and stopping and checking in with people, and that takes both time and money. You want to make sure that the people who are who you're involving in solving this problem, who you're doing your user research and your interviews with, are compensated for their time, particularly if they're providers or family members. And slowing down and stopping and asking somebody for their input is always going to be time intensive, and that's a different way of working, and can be very challenging, especially when we have very urgent problems that we're trying to solve. A third challenge are power differentials. And the way that you could start to mitigate this is first step is acknowledging those power differentials, right? When someone from a state agency or a local government agency is working with a provider or some other member of the workforce, we have to keep in mind that there is a power differential there, and it might impact the way that people feel, the comfort that they have, their ability to be truthful. And so you really want to focus on creating safe and productive spaces when you're doing this work and you're bringing different people from different parts of the sector together. It always helps if you really ground in our shared outcomes and foster productive conflict, knowing that the beauty of this process and this framework is all about bringing people with different perspectives together. And when you bring people with different perspectives together, you are probably going to have some conflict. And conflict is not always bad. You want to make sure that it's productive. Obviously, you want to model kindness, encourage risk-taking, and structure the session so that people feel like their time is well spent and they're not talking in circles or not achieving anything. And then what we have found time and time again is facilitation is key, again, to making sure that the sessions are structured well and everyone feels like their time has been honored. Next slide, please. And so I'm just going to leave you with this slide, which are just some best practices for co-designing and using human-centered design with both families and the workforce, or with anyone, really. Key is engaging your end users. So again, those people who are in the field, who are closest to the problem, early and throughout the design process. So when we at Start Early use these processes in our work with systems leaders, we don't just talk to people during that empathize phase, but we circle back and ideally, if resources allow, also try to involve end users in the brainstorming and the design aspects of this, of these activities as well, so that you are working with end users at every step of the way. This is very different from how we traditionally do our work, even if we are at a stage now where we will send out surveys or have focus groups at the beginning of a project. It's still rare for people to invite members of the field into our offices and our spaces to really sit at the table and be involved in the ideation and the designing of our solutions. We ask that everyone steps up and steps back, and this applies, regardless of what your position is. Some people are very active participants, which is great. And then sometimes you're going to want people, especially people in positions of power, to step back and allow other people to talk and learn to listen. As I said, slow down. That is, there is no one time frame. People often ask me, how long is it going to take for us to go through a human-centered design process? It really depends on what you're trying to do. A cycle can be a day or it can be 6 months. But you really don't want to rush through the process, and be very intentional so that you can cultivate meaningful engagement. As most people know, the work that we do is really dependent on relationships, and if you can foster relationships, you're going to have better outcomes. Embracing uncertainty is a big best practice for this work. Again, if you go into this knowing exactly what you will come out on the other end, you're not going to be open to new possibilities. And sometimes it can be very unsettling to not know, especially if you're a couple of months into the work and it's not quite apparent yet. Trust the process. This is all about divergence and convergence, and sitting in uncertainty is actually a skill that you want to generate, because it means that you're open to new possibilities. Again, testing and iterating is part of this process. Letting go of power, which is kind of related to embracing uncertainty as well. Being open to possibilities. And then these mindsets that we really try to foster: humility. Everyone is an expert in a way. And really, this is just about being open to different types of expertise. Being curious about what other people have experienced and what their perspective can bring to a problem-solving process. And then, of course, CQI, as we've said probably throughout this series, we are constantly trying to make sure that we're improving and, again, designing for a changing world. And I believe that was my last slide. Happy to take questions in Q&A. Thank you very much.
Sheetal. We do have actually a few minutes, if my clock is right, and I know Sandra will tell me if I'm wrong, but I think we have a few minutes to address some questions that have been put into the chat that particularly focused on DC, but there may be questions for Sheetal as well about human-centered design. So if, let me just suggest, Bibi, there were a number of questions directed to you. Do you want to respond to them, at least some of them here briefly, and then we'll turn to Sheetal and see if there are questions that have been raised in the chat.
Sure, I tried responding to the couple of them on the Q&A. One of the questions was around experience versus credentialing, which is, I think, a really critical question. So we did build in a 10-year waiver into this work, both for the credentialing piece and then working through the same with the compensation, because we do realize that there are people who have been in the business for a long time, especially older providers, early educators who may not go back to college and get an AA degree, but really have the experience and the years of experience. So part of what I talked about in terms of gathering data has been the difficulty of not having a registry, not having kind of the platform where we can see that right out. So that has the waiver process. People have to apply for it and have it verified by their employers. So it's a bit cumbersome, but I think we're working through that as a critical piece. The other was there was a general question about womb to 5 or whatever the age group of children, as well as prenatal care. And our birth to 3 legislation really does focus a great deal on home visiting, on breastfeeding, on a number of different aspects that are really geared towards young parents having social workers with their primary providers, et cetera. So those are the couple of questions that I think I saw.
Okay, thank you. Chantal, I don't see questions, but I would ask you if there's additional thoughts you have that you really want to clarify, or points you want to, that you felt you didn't have time to, because we gave you a time limit. But is there
Yeah.
anything else you want to add at this point?
I can't think of anything off the top of my head. I am very happy to take questions if somebody wants to pop a question in. I thank you, Amy. I see your Q&A. The resources, again, I'm happy to share IDEO and the D School, and at Start Early as well. You know, we have resources to help systems leaders, in particular early childhood systems leaders, to use and apply human-centered design principles. So, you know, please visit our website for more of those resources as well, and case studies.
Great, great. Thank you. Thank you to both of you for really insightful and excellent presentations for our audience. I really appreciate it. Sherry, you have any other thoughts or comments? And then I'll close out. Then we'll turn to Sandra.
No, just want to encourage you all that this has been a journey over the 6 sessions. And so we tried to sum it up today, and I think end it with a process, a way for you to put it all together, but we're available as you think through your next steps.
So on behalf of all of us who've worked on this foundational series, I want to thank all of you who've joined us. I want to remind you that all the webinars are available online at the National Center's website, and encourage you to use those tools to reach out if you have particular questions or concerns to us about them, or about any of the issues that we have talked about and raised. Sherry and I in particular wanted to remind you, I think something that has been really made extremely clear throughout this session. We all know this is very challenging work. Many of us, including many of you, have been doing this work for a very long time. And some of you are new to it, but you can't enter this area of policy work around the early childhood workforce without immediately realizing that this is a really challenging area. And we think that this question of financial resources and sustainability is one of the key areas we have to address. That, and is really related very much to the issue of workforce compensation. And that's a key driver of the change that we need to see, and that the National Center has been really designed to address and to support all of you in the work that you're going to do in the next number of years. We want to impress upon you the kind of process that we've talked about, and just remind you about looking at understanding root causes of inequity in the early childhood systems. They are key to this. Taking action, not just thinking is an action too, but being able to take action. And when we say taking action, we mean using your role and responsibilities to begin to move in perhaps more inclusive direction, to have perhaps address something you haven't addressed before. Remember, we've asked you repeatedly, who's at the tables you are sitting at, and who's not there? How do you include, and should you include, people who are not there? So taking action is critically important. We want you to work with people. We want you to work with programs and structures. We want you in particular to work and listen to the early childhood workforce, and what they are telling us they need. We know from some of the work that has been done currently that our workforce is very aware of the expectation that that within the profession, people will gain additional education. But they also are not necessarily able or willing to gain more education if in fact it's not going to lead to greater compensation. It's just, it is the linchpin in many ways in this work, financial resources and the compensation and benefits issues. In addition, we talked about using data and how important it is to gather data, use data, look for new data, make partners who can help you get the data you need, critique the data you've got, use the workforce members and others, family members, community members, to look at data. What is it they want, and what kind of data do they need to see? We encourage you to plan, to decide, to monitor using data effectively to make the change that needs to be made. And we want you to leverage your roles, responsibilities, and influence as leaders and in the roles that you currently have. Next slide, Daisy. In addition, we hope that as you do this work, Daisy, you have another slide? No, are we done? No, we're not done. I know that. Thank you. We have covered a lot of topics in the last 6 sessions. We've talked about data, qualitative and quantitative, and we've also encouraged you to use the CSCCE index at Berkeley, which is also, you can look online at the National Center and see access to that information. We've asked you to and encourage you to collect stories that can help flush out the data issues that are missing. We know that a lot of workforce members have been asked to tell their stories, and they're sort of sick of telling their stories and they want action. But this is not it. While learning stories is important, it's very important to help us understand, as Shital said, for us to understand and empathize with what are the actual experiences of people in the workforce now. We also know that we need those stories to just drive the policies that we propose, and we also need to use those stories to gather more people to our work. So very often, for instance, if BB mentioned, going and making a nuisance of oneself with legislators, she used that phrase, but I don't remember exactly the phrase. It's very important to be able to help legislators, business leaders, and others who aren't typically thinking about early childhood, perhaps, to understand, and particularly the early childhood workforce, to understand what are the experiences of that workforce and why do they need a response from key policymakers in the state, from the governors, from legislators, from mayors and others. So the stories are very important. We also know that you have to build, and we've stressed this, effective networks for workforce systems reform. The networks cannot just be in our silo. I'm in early education. I don't have to think about anyone else in any other area of this work. And I'm only in this one little corner of early education. We have to think broadly. We have to be able to think about what is the change we wish to see across this whole field? Because if we only fix the problem of compensation and benefits and these other issues for one sector of the workforce, we are still going to have the problems for all of the other people whose issues are not addressed by that one fix we made. So it has to be a broad fix for all sectors. And we need to have all of you being able to use these tools that we've talked about in multiple ways, in multiple arenas, and for multiple purposes to bring about the things that we want to change. Next slide. So we wanted to ask you, you probably can't get out of this last webinar without at least another poll or question. What are your next steps? What are you going to do next? In terms of, you can respond in terms of financial resources or sustainability, or you can answer in terms of the broader question of what are your next steps to support the workforce? So either way you answer that, just share your next steps with us. Advocate to lawmakers, good. Convene a COP, excellent. 2 responses. Try to build buy-in from those with the resources, participate in local forums, create local resource guide, get feedback from staff and parents, look for partnerships, set up monthly meetings with county coordinator, have an AAS advocating, great, listening and applying what I learned to benefit all members, great, looking to make our state credential competency-based, create more incentives, access what, these are great next step. State educators, working with officers, monthly benefits, work on sustainability. Excellent, excellent. So these are all fabulous, fabulous next steps. 22 responses. So appreciate you answering those. We want you to, as you move forward, to think within your roles, responsibilities, and authority. What can you do? We want you to build for equity and inclusion and community. Don't be a superhero, but join with others. Remember, this is not work that one person can do. We've shown that in our field repeatedly. It takes a village, and we're the village or the herd or whatever metaphor you want for us. It takes all of us working together to get this done. We need to build broad consensus. One of the points BB made was they really built a big coalition, and that is very important. Determine and expand who is at the table, build networks across systems, listen intensely to the workforce and respond to them, and focus on sustainability to carry the work. With that, I want to, on behalf of all of us, just thank you all for the work you do every day for children, families, and communities, and particularly for our workforce. I wish you well, we all do. I hope to hear from you in the future about your successes for your state and your county, your tribal community, or your agency. So be well, be successful, and fight on. Thank you. And now turn it over to Sandra.
Thank you so much, Dr. Ray, and thank you, Dr. Killen-Stewart, for your amazing facilitation throughout this series. Thank you, Sheetal and BB, for your presentations today, and to all of you who've participated throughout the series, whether it's been attending each and every webinar or watching the recordings. We're just grateful for your participation and your digging into this content with us. We do have one final webinar, post-webinar survey that we'll ask you to take a few minutes to complete today. There are questions in there that will help inform. We do have one more consultative session for this series that will be on May 21st at 2 p.m. Eastern. So it is in that post-webinar survey that you can give us a little information about what you're interested in digging into more deeply during that session. And for this final survey of the series, we also have some questions for you to give us information about your experience and feedback about your participation in this series overall. So we are very appreciative of you taking a few minutes before you go on with the rest of your day to complete that survey. And beyond that, we are just grateful for, as Aisha said, the work that you do on behalf of the workforce every day in your community. And we wish you all the best. And we'll see you in our future convenings with the National ECE Workforce Center. Thank you.